This is my acute care evaluation debrief. So, some things on the checklist that I found I did not do is I did look at, ask my patient for his ID, but on his ID bracelet, he had the wrong name and date of birth. I did double check with him that it was the right surgery, right name and everything, but I should have went and got the nurse to see what was the mistake, or if that make sure he had the right credentials. So that's the first thing that I definitely could have worked on. Another thing was washing my hands before it. I did look for hand sanitizer, but I didn't see it right away, so I just kept going with it. So that's just definitely a big thing that I need to do when I walk right in the doors. Look for it throughout the whole room, not just my space. Let's see. I took vital signs in the beginning, but I forgot to take them when we stood up. I didn't re-look. I looked at the screen, but I didn't take mental note of actually what they were. I know they were okay, but I know I need to write them down so in case something does happen that the nurse will have them. So I definitely needs to make sure that post-activity they're also written down, so if any emergencies happens, that is there. Another thing that I didn't really look at is his breathing as much. He seemed to be breathing okay and not exerting himself very much. So I kind of thought that was good enough, but now looking at the sheet, I definitely should have looked into more auscultation and just make sure he's good. And then another one that I forgot to do was a cranial nerve screen. I did everything else in that kind of neurologic thing, but that one slipped my mind. And then I did not get to any interventions just because I lost track of time, and by that time it was the end. But I was able to stand him up and get him to a chair and then walk him back. So I guess that could be a form of interventions, is walking to a chair and then coming back. And then I did not do any patient education since he's going to be in the hospital for a few more days before we can discharge him. Okay, so the next parts, no, I did not complete the full evaluation just because I didn't fully get to the treatment session, but I did complete all of my measures that I wanted to complete, which was good. And then the thing that I was most surprised about this experience is how I knew it was intimidating going in it, but then actually starting on it, I was surprised how cool and calm I became when I was actually interacting with the patient. And it was also really nice that it was not just with our cohort now, but it's with actual patients, so it's feels a lot more real, which I think calmed me down also. And then the most challenging about this experience is definitely time management. It was hard to keep track of the time and be within the time. And then two strengths that I felt I had in this eval is my communication skills. I feel I did a very good job at explaining everything to my patient, always making sure I'm talking to him, making sure we're on the same page, and kind of just talking to him about life in general so he can gain that trust with me as being his physical therapist. And then also another strength I had was showing empathy toward my patient too, understanding that this was his first time having physical therapy, ever seeing one, having surgery, anything like that. So I made sure that he knew that I was there with him and going through it with him. And then for mobility wise, I thought I did a good job at managing the lines. I knew I wasn't going far, so I didn't have to move them as much, but I know if I did have to move them at a farther distance, I would have unhooked the O2 line, which was kind of the thing that was most getting snagged. And then plus his IV tape kept coming off, which was out of my control, but just making sure that wasn't snagged too. I felt I always kept watching that also. Some weaknesses that I had was being organized. when I first went in it, I thought I had a very good like eval template, knew what I wanted to do, but then I got in front of the patients and just wanted to keep going. And then I realized, oh shoot, I forgot stuff and need to like backtrack. And then like looking at the document, like you don't really have a lot of time just to like stare and read down your document when you're one-on-one with the patient in like an acute care setting like that. So I feel like then I was like reading it and I was like, oh, this went in the wrong order. So I definitely can be better at that next time. And then also something that is big, even talking right now, is slowing down with the patient. I'm a very fast talker, so I need to slow down, make sure my patient knows that I'm fully listening to him and not getting lost by what I'm saying, which is really hard to do, but I definitely will work on that. And then, so what I'll do to be better prepared for next time is that look into the case a little bit more. I was pretty prepared for this one, but there's definitely some things that I could have prepared better, like interventions, so I wasn't like as scatterbrained, and then make sure my template is better. And then I also want to make sure that my EMR is more up to date and complete so I don't get as lost in the session. And I am very excited for next week's, and we will see how it goes.